I'll try to be real quick. I mentioned that we have a private facility in my hometown that is a not-for-profit designed to try to assist young adults who are disabled in a home setting, and ran into a quirky rule, and I'm not sure where it comes from. Maybe some of you can tell me, that one of the residents was on the initial board and lived in the facility, and apparently it violated the rules, and he had to move out in order to stay on the board. Now, this is sort of contrary to what we have with public housing, in which your board has to be made up of a certain percentage of the residents. Have any of you run into that before? I'm still trying to track down where that's coming from. Okay. Anyway, to another issue. Ms. Beckett, I certainly agree with you on the employment side of it. I think one of the important things is to make life as full as possible, and people with disabilities who can work ought to be encouraged to do so. That sort of ties in through the Department of Labor situation with something that Mr. Gronefeld, is that right, mentioned earlier about the personnel and some of the impediments to employment there. Are there Department of Labor restrictions that you encounter in the employment of disabled people, and if so, what are they?
It's not really the Department of Labor, although it's, labor is a part of all of this. One of the, I think the biggest thing is the fear that they're going to lose the types of benefits that they need when they go to work. Plus, it's also on the part of the employer, they're concerned about having to pay for the health benefits of an individual with a disability. Katie doesn't have a very good track record, and so an employer looks at her as a liability as opposed to a positive aspect of what it is she can provide. When you're going up against that, that is just totally irrational when you think about it.
Well, I agree with that.
I think it's really important for us to make sure that the Department of Labor is reaching out to different employers and talking about and helping them to work through some of the issues that people with disabilities really have that could be beneficial employees to them.
Yeah. We have a rehabilitation workshop in our community, which does pay at a reduced rate, but it does provide employment there. And I suppose they come under some kind of a labor standard waiver. You're saying it probably needs to be expanded.
It absolutely needs to be expanded. We have Goodwill in Cedar Rapids. That's not an appropriate placement for Katie. She really needs to be in the workforce. She's been a receptionist in the past. She's worked from the time she was 16 years old. And as a matter of fact, the person who hired her was the manager of a record shop. As a teenager, you can imagine what that meant. And she asked her if she'd like to work for her because Katie knew all of these things about when releases were supposed to take place and who are the best artists and, the whole 9 yards. Well, that's what we need is somebody who's not afraid of that.
I agree.
And at the time, because we're in a small community, that's something you can overcome. But over time, it's really difficult when there's more and more fear about health care and the rise of health care costs. That becomes a real problem. Katie is now meeting with Rockwell International, has a new government contract. They build airplanes and do all that kind of stuff, communications, and they need 310 employees. And they're meeting with Katie to talk about how they could hire people with disabilities and not have to worry about the health care costs, and because it's very difficult. Well, we have a wonderful Medicaid buy-in program in the state of Iowa. It's not overly utilized. We'd like to see it utilized more, but it is an opportunity. And our state Medicaid director says it's too difficult to figure out how to do those premium things and all of that. If people really need Medicaid, they should be able to buy into the program and not have to pay the premium for it. So they don't charge premiums in the state of Iowa, even on a Medicaid buy-in program. So to me, those are the kinds of things that states can really be encouraged to do that would help individuals, young adults in particular, get to work.
I think we all need to work on that. Very quickly, Mr. Chairman, if I might ask Mr. Gronefeld to elaborate once again on, you say that we have programs in place that are trying to put people in an employable status, and yet we have this shortage in this healthcare arena. Would you elaborate specifically about the kind of impediments that are there?
Well, there's two primary impediments. One is the average wage rate that is expected in order to be a successful placement. Both the Job Corps program and programs under the Workforce Investment Act and TANF require specific wages in order to measure success of the contractors putting people to work. Unfortunately, the wages for direct service professionals is below that threshold, and so that hurts the outcomes. And again, as I mentioned earlier, we need to get those wages up, but we could get a lot more people into the system and providing services in this field if we could remove some of those impediments to getting people trained and into the programs.
I just wanted to ask one question, then we'll wrap it up. When you were talking about Katie's track record, do you mean in terms of services that are available to her? What were you referencing?
Well, what I was referencing is the fact that she was $1 million baby before she was 2.5 years old.
Oh, okay.
So her track record's not very good when it comes to healthcare services and needing that healthcare. What a lot of people don't realize is once I became a University of Iowa employee, and that was in 1984, because they're a large group employer, they could not, they had to accept Katie as a part of their plan. So she actually, while she has the Medicaid waiver, and now she has a little bit of Medicare because she's old enough to do that, she also has private health insurance. And private health insurance has paid most of Katie's bills as opposed to Medicaid because I went to work for the University of Iowa. I no longer teach, and the teachers who were here earlier, and I have to tell you, that's been a really difficult situation for me. Every September, I miss going to my classroom, and I miss my kids because that's what my life should have been. Instead, I'm here. I'm thankful that I get to be here, but it's also not my life, not the way I would have liked it to be, but I can't help that. I work for everybody in this country anymore, works for their benefits, and Katie's benefit is that she gets to be covered by health insurance, private health insurance, even though she has this wonderful Medicaid waiver program that's very, very helpful to her. Even Medicaid doesn't get coverage for everything you absolutely need to have. But you'd think she'd be covered on everything if she has all three of those, and she's still not. So that's what I meant by track record. When I say she's my $1 million baby, I mean she's my $1 million baby. Thank you.
Okay. Thank you so much. Thank you, all of you. We really appreciate your being here today. And understand that, this is basically a broad hearing because we wanted to hear about some of the problems relative to these rules, that might go into effect. And also wanted to hear some comments about legislation, but we do intend to follow up. And I would just remind everybody, my colleagues as well as the panel, that members are allowed to submit additional questions for the record within 10 days or so. So you may get some additional questions that we'd ask you to respond to in writing. But again, thank you all, and thank you for all the advocacy. I should say, that in my district over the years, and of course, Ms. Thomas, your group in particular, but everyone has always been very effective in, bringing attention to disability issues at our district office, or when I have, whenever I have a town meeting, I always have representatives from the community that show up, and I think that advocacy is really important. So please, I'm sure you will continue to do it, but I do want you to know that it's effective. And without objection, the subcommittee hearing is adjourned.